It's my profession, and this is where I live. I live in the state of Massachusetts. So I've seen the Affordable Care Act. We also call it Romney Care or Obamacare, take your pick. We've seen it actually roll out, and what we've seen is that the Affordable Care Act actually, in the flesh, is neither affordable nor caring, because in fact it provides stripped-down plans which are fairly expensive unless you are in a very low income, unless you're poor and you're covered. Costs go up astoundingly. So if you are making less than $20,000 a year as a family, you're covered, and it actually has expanded care for the very poor, and that's a good thing. But if you're in that $20,000 to $40,000 bracket, so near poor and fairly poor, I think by many standards, actually your costs go up 5% of your income, which is just a staggering amount of money to add an additional 5% of your income to your health care costs. And yet you are not covered. So on average, these plans cover about 75% of your costs. Or actually, I think it's more like 70% of your costs, yet you're paying approximately 10% of your income for them. So it's not affordable for families. You're not fully covered. The proof of the pudding here is that when people get sick in Massachusetts now, they go into medical bankruptcy just as much as they did before we had the Affordable Care Act. And it's certainly not affordable for government, not for state government, not for municipalities, not for small businesses. Costs are skyrocketing, and it's cannibalizing all other aspects of budget. The answer here is Medicare for All, which provides care for everyone comprehensively. You are in charge, not your boss at work or not a profiteering CEO, but you get to call the shots. And well-kept secret, it actually saves us trillions of dollars over the coming decade because it eliminates that massive, wasteful health insurance bureaucracy, and it stabilizes medical inflation. So it is a win-win. It's absolutely, it's a sign of how hijacked Washington and our state capitals are that we don't have Medicare for all right now.